Hello, I'm back. I apologize for all the technical challenges earlier. I hope you all can hear me and see me. Hello, can you hear me okay? Can you see me okay? That's great. That's wonderful. As you know, I'm not the real expert on this thing. Barbara, my wife, is always the one that's handling the technical side of things. But anyway, so we want to talk a little bit about heart surgery, right? Or heart treatment in general. So I call it plumbing of the heart. Essentially, that's what it is, right? The commonest cause of heart disease is blockage of the coronary artery, right? So now, years back, when the thing first started, well, if you go back long enough, nobody actually dared to do any surgery on the heart. And then, way back in the 60s, and some people started to adventure and get into the heart and do surgery and so on. So the initial treatment for people with blockage of the coronary arteries was heart surgery, bypass surgery. And this was started by an Argentinian surgeon in Cleveland Clinic, where I was some years ago. But before that, obviously, they have to do the angiogram first, that is to take picture of the heart first to diagnose or to determine where the blocked artery is and so on, right? So, and because it was very, very common, even way back in the 60s and 70s, people had to go undergo this kind of bypass surgery. So that was the only thing that was available, and citizens became very, very busy with all this work. Now, in 1977, a German radiologist and cardiologist called Andreas Gruentzig, German, born in Dresden, started thinking about an alternative way to do the thing, because he was a radiologist, so he thinks along the pictures and so on, right? So the first case of angioplasty was done not in Germany, but in Switzerland, in Zurich, right? In 1977. The exact date is 16 September 1977. Now, at the time, there were a lot of skepticism, and he had to get approval not only from his cardiology head, but also from the surgical head, right? Obviously, if the surgeon at the time said, no, you can't do it, because if you do and something happened, I would not save the situation, then probably he wouldn't have been allowed to do that. So the surgeon, a German surgeon called Dr. Senning, was quite generous and quite evangelist, agreed to stand by. Right? So that's why Dr. Gruentzig managed to do his first case. And surprisingly, his first patient, German patient, was quite young and quite healthy, but he's just a single block artery. So he, even though he knew that this was a new procedure, when Dr. Gruentzig explained all the details to him, he agreed to have that procedure done. So this was the first balloon angioplasty that was done on the coronary arteries. And it was obviously very successful, otherwise you wouldn't hear about this thing. Now, if say nowadays, probably it would have been difficult or maybe not possible to do this thing, because conventionally doctors would say, well, we practice evidence-based medicine, right? So they will say, well, so what's the evidence that this thing works, right? but this is a new thing and it hasn't been done before, so there's no evidence that it will work. So you follow conventional rigid thinking, you can't do it because it's new, never been done before. There's no evidence base, right? So anyway, so there are people, there are pioneers in any procedure that dare to attempt new things and dare to do new procedures and treat new people and so on, right? Now, as I said, surgeons at the time were very, very busy with their open heart surgery, not only with coronary bypass, but also with valve surgery and all the other types of surgery. And so really they didn't have a real interest in this kind of procedure. If you look back a little bit, these are new procedures, right? So cardiologists never done it before, and surgeons, of course, wouldn't have done it before. Right? So, but unfortunately, at the time, surgeons didn't have the foresight to look beyond their limited field. They didn't realize the potential for this thing, right? Because obviously new skills need to be learned. So, if we at the beginning say surgeons could see the potential and could see how they could help patients, right, by doing this thing without doing open heart bypass surgery, then they would have gone into the lab to learn these tricks, to learn all these skills, right, and to be able to offer patients the choice, you see, because obviously cardiologists can only do the angioplasty and subsequently angioplasty and stenting, but they're not able to do the open heart surgery, the bypass surgery. And so when surgeons have to, what we call standby, to be available to rescue the situation if something unfortunate happened. So, but if you look at the starting block, either the surgeon or the cardiologist, they are learning anyway, right? So it could have gone the other way. But unfortunately, as I said, surgeon, first, because you were too busy doing the usual open heart surgery, and secondly, they didn't have foresight to see how this was progressing. So at the end, now after years and years, in fact, back in the 80s, angioplasty and stenting have already overtaken surgery as the main treatment for coronary heart disease. So surgeons lost control of this situation, and surgeons are dependent on cardiologists to refer them the patient for this open heart procedure and so on. So the emphasis there is the control of the situation, right? So if you in any specialty, if you are in full control of your profession, of your procedures and so on, then you have a better chance to direct the flow and also to be able to determine what's the best for the patient. As I said previously, even though numerous studies have shown that for certain categories of patients, bypass surgery is better to done in terms of the long-term survival and so on. Because we do not have the control, we do not even have access to the patient before they go for treatment, the argument is not really that strong, especially in a situation where the doctor's income is almost totally dependent on the number and complexity of the procedures and so on. So the emphasis here is on the control of your life, of your lifestyle, of your situation. If you lose that control, then probably you would not be able to determine how far you can go and how successful you become. So when we talk about control, if you look outside the box, isn't it much better to be an independent business owner, whatever business you're in, right? So if you are an independent business owner with a strong network of friends and colleagues and associates supporting you, then you are in much better control of your situations. Isn't it much better than to have to rely on your competitors, right, to give you cases, to give you business, to direct what you are able to do, and so on, right? So the basic concept is to have control. And if you are the owner of your business rather than an employee, then your fate is determined more by you than by your superior, by your bosses, and so on. But of course, the kind of business you go into is important, right? If you're in the business where you have to put in tons and tons of capital and so on, then the control of the situation is still not great, So again, because you'll be influenced by so many other factors, external factors, and everything. And in our present situation, by COVID and so on, right? Because you can be having your own independent business and so on, but because of lockdowns and economic situations, the business has gone right down, and unfortunately a lot of small and medium-sized businesses are struggling, and some of them have to close altogether because they're not allowed. Initially they're not, because of the lockdown, they are not allowed to open anyway, and then because of various challenges, people are not going to them. And I said previously in my previous life that hospital doctors in private hospital, right, have reduced number of patients going to them, right? So that is the problem. So we do not have that kind of control, right? So if you have a business where you are independent, and where you do not have to put in a lot of capital, that is building your strong network, right? So independent business owner with a strong network, and that's the way to go. So this is what we are talking about here. Building network, people network marketing. And there's one industry which is really improving, progressing, bursting out in leaps and bounds despite or maybe because of this COVID-19 pandemic. Anyway, so if you want to know more, then do let us know. We can explore further. I apologize once again with the technical challenges at the beginning. I'm getting better at home, and I'm learning all the time. If you liked this video, if you like the content, do leave a comment and like and share this video. I hope to see you soon with further musing on all these. Thank you very much for joining us today. Bye-bye.